Good morning, everyone. Obviously, we have switched over to 11 a.m. now. It's Monday, May 25th. Premier will speak very, very briefly, and then Dr. Patterson is going to make a statement about Nunavut's path, our document, and public health framework about moving forward during COVID-19. Thanks.
Lakut luminagadja May 25 sibulik de khalimalawlone luta Patterson naluna yelang ayo ane hanglang itulirin ang mo tuwang naktulirin yung matukta balian yang ngani.
Nunavut ubla check-up papi. Mana mo tikidli utana numan na 19 Nunavut iloning ito huli na kuwenak to. Maubli mo tikidli 110 kawi haktaw himayud numan na 19 kanyang mangata. 122 huli utak kaya but kawi nang ito hulian ng mangata. Then watch out na na iswa kayo mga Dr. Patterson unik kaya na naman kanota na Nunavut ukwa padla o yang nila mga takwa nang minakakto pilira kakto pa-repeat kawi mayugot na pekko hiya but adjiw ngimat maadjiw lang ito na Nuban na 19 na anya kutimi kaputimit hanakak nagit ubaluba nanihikakit nagit kihanita na Dr. Patterson na pilari chakto ni takwa pilari katingi pilari rakto dito kano na ukwerti padlaraw yang na mga takwa Nunavut iloni tayo maunik ka na man kihanita ko pekko heriya but man huli atok tara katawata kanigi luangin mithatang na ublalwa tangin na kihan ukwa padlaraw yang nalakto amata ko mat apagebo wakta katakwa pilere ralaw tutapo minga parnay law tut atwa ko tiuna to makano ukwa padlana mga mat apaka tana pilere ralaw mata tana hanatay kuliulak to tana atulak tabut tayo mo ukwa padlaraw yang nalaman unika chang naman amata ko Nunavut miumat na wakta katako nalat chata lang mata pekoyaw unit amata ko nang minakaktut ukwa taktilu takwa nalat chalaw mata kihan ukwa padlaraw yang nalaman Nunavut ilwani takwa Nunavut miunalat chang na put Dr. Patterson mi kan ukwa padlaraw na mangan amat takwa ihumalanga matchakto tan ublo hunawlak pa ukwa padliana mga ukak himang ito ukak himayo takwa kawi haktaw ya lugi ukwa padlia kanara kang mga ubalo tay kaninok ngalawli ubalo ba ukwa padlia ya kanalita tan kanonuban na ya tiking ipat Nunavut miuta ukwa padlia yang namang unamata matnaw yuhing. Good morning. There is still no confirmed or probable case of COVID-19 in Nunavut. Today, the total number of people under investigation is 1,010, and 122 people are still currently under investigation. Dr. Patterson will speak in a few minutes about our next step as we navigate our new normal through COVID-19. Although this virus has not been present in Nunavut so far, we know that we have been prepared and vigilant until a vaccine or treatment are developed. Dr. Patterson and his team have developed what I think is the best framework for Nunavut Mew. Based on public health evidence, it sets out a course for how and when to move forward, and when to pause and reassess, and if and when we have to reinstate restrictions. Thank you to everyone who has worked so hard to set up this plan, to everyone who has been involved in Nunavut's response to COVID-19 over the past 10 weeks, and to everyone who has done their part to keep this territory safe and well. We still have a lot of work to do, and we will continue this path forward together. Thank you.
Good morning. These past 2 months have not been easy, and most Nunavut have had to make sacrifices. However, thanks to these combined efforts, we are protecting our families, our communities, and our territory from this pandemic, and I hope that all Nunavummiut can feel a sense of pride knowing that their actions are making a deep and measurable impact on keeping Nunavut healthy and safe. It is time for us to move forward. This does not mean that this pandemic is over. This does not mean that the threat has passed. This means that we can cautiously begin our return to the activities we enjoy, knowing that at any time we may need to change our behavior to protect ourselves from the emerging threats. In the coming weeks, we will work with our stakeholders to reintroduce our businesses, our activities, and our programs in a way that is safe, sustainable, and poses the least risk to the health and safety of Nunavummiut. Know that as we begin to loosen restrictions internally, it is imperative that our border measures remain to minimize the risk of introducing COVID-19 into the territory.
Ulakut, takuam tak makku simayuni takhi yuni at naktuko simagata. Nunavummiut limalo mga isumay nakigunaw timinik sakwe kaya kaksimamata. Kasi anili kuyan nami katujilo tatamakwat suru tigi simayabut sapumigat tigo ilabut nunakativut amalo Nunavummiut tamatumanga siya mapalya simaningani. Amalo Nunavummiut limaan tayo maupigusut siya reali Kawai malutik, kano ilirot tigi simayangin, ato tihat siya tumik, ato inahat siya sa mama, Nunavut at tanak tumiko nagu, kano iko natalo. Sipumugaya kalirat tali, kasi ani taman na anigong itok suli siyang magpalya nga Nunavut malutuk taman na suli kapya ng ninga, suli sakyak tu ganoa, kasi ani tukikak, taman na objek sut siya luta, utik palya na alak tugot, huwagi yatin no kano ilirot tiyo katak tuning. Kawai maluta hanga tuwin nak asidjek tao gunak tu taman na sa pumiyaw kuluta ilo nata ang malukapya ng sa pumiyaw siya sa makuluta. Pinasaw sigalaw na apto na pilari katigin tabot ilaw kataw giali sakirtit sa balya luta matuyag tao balya ningin ni namin nakaktiyo yun kano ilirot tiyo gunak tu pilari abullo. At tanang itukut ang malo ulura naktumitit si tayo luta Nunavummiunik. Kawai mana ako si taman na kasuyaw balya na atilugay sulit tabi liya tutitaw si mayo tamani Nunavut ilo ani pimario na aktok tamakwa asago bekang ito kiglitin ni Nunavut ilo ani suli matuyaw si mani akto taman na Nunavut 19 Nunavummiut sakikunag.
With that being said, I'm pleased to announce that as of June 1st, daycares will be permitted to open up for business. The size limit for outdoor gatherings will increase to 25 people. Territorial parks will be allowed to reopen for outdoor activities only and if local circumstances permit. Public park buildings will remain closed. Municipal playgrounds will be allowed to reopen again if local circumstances permit. These particular conditions have been selected because they are low risk. Moving forward, our plan is to reassess our condition every 2 weeks. If the state of COVID-19 in Nunavut is favorable, we will continue to lift public health measures, continuing with lower risk activities and programs. If the conditions are stable, we may remain at the status quo until we are confident that lifting additional restrictions would not pose an undue risk to Nunavummiut. Finally, if the threat of COVID-19 increases or eased public health measures are posing a potential public health threat to the territory, we may need to introduce or reintroduce certain conditions.
Tako kau sirilang lugit hubiat tungan alunay sigun na kama June 1 pigi aluni pahirbilimat matuyarod na latut ang malukat siyo ningit sila may katigun na hatak tu ami sungurang lutit 25 ng hatakon na lasi yun Nunavim miming nguyar sirbain matuyat tagun naksit yun kisya ni sila may kanoy liyokot sa kakon naklutik ang malununangin ni kanoy gayaw ngipata may nguyar sirbain lungi suli matumanak tu Nunalin ni gawa magkuping mga bikuting sila may suru sila anot matuyag tawagun na mayakto ang malo nunalin ni tayo makakanoy gayaw ngipata. Tamak ko madik tawag ay nagataw si mayo tayo maulo ka na ngitumirnik sa gunam ning inot. sibumugiarluta parnautibut khawayasaqpalliangin nakhattarniartavu maqtuupinasaaqussiinaagay patik ammalutamanna nuvajuanaq 19 Nunavut stikisimanngippat suli takkua matuiqpalliaqattarniartavut kinguliriittartitaulutik takkua uluqiananginersai matuiqtauqattarlutik hanuiliqutiuyu pillirianguyullu ammalutamakkua suli suqqapalliangippata taima suqqatsaangittu nalungikkutta tamakkua haakkanningagu sulittarbiutitauyut uluqianartumigigu taujaangit surituarukkit Nunavummiunut malukingullerpaami tamanna kappianarninga nuvajuanaq 19 saqqipallialerneqqatamanna matuiqtauvalliassimayut uluqianartumiititsigutiusorigukki Nunavummi saqqirtaukannituinnareeli tamakkua maliktaugiaqartiqattarsimajakka.
I share in everyone's desire to a return to normal. We all want to know when we can confidently and safely travel within our own territory or to neighboring jurisdictions. However, trying to forecast specific dates and timelines for when we can lift all of our public health measures would be inaccurate and frankly insincere. The COVID-19 pandemic is evolving rapidly, and every single week yields new information that shapes our strategy and our public health measures. Predictions and decisions made on the basis of today's understanding of the virus may be obsolete in a short time. For this reason, we have opted for an approach that is flexible, cautious, and adaptive to the evolving situation around us. Again, I want to thank all Nunavummiut for their continued patience and understanding. No one is left unaffected by this pandemic, but our collective accountability has kept Nunavut safe so far. This accountability and responsibility needs to continue, and as we loosen restrictions, we all must continue to practice social distancing, stay away from others when we are sick, and to wash our hands often. Thank you.
Taima kikkulimaatitut uvangattau taima inuusirmalauqtartinnu utiqumagaluartunga kisaani qawimatsaara haqatta nalungitsaarluta uluqianartumi gudneerutta kisiani Nunavummu tikiqattarunnarsilaangata taakkualu qanigiyavut avittursimaviuyut asinginniingaaqattarunnarsilaarsuti kisiani kinguniagu kisianili tamakkua qaqangallata ullunginni nalunaersikasuarneq tamakkua qangakquyanaarta vallianiarmangaata malittaugiaqartitauyut tammarsumatuinnareaqangata ammalu atuutexaqayaqani tamanna nuvajuanaq 19 searmapallianinga hasijipallianginnanga sukattualummik ammalu pinasuarusitamaan nutaanik tukisiyaarutini saqqirtuqaqattarsumi taakkualu qanortuurutivut aanneaqarnangittulerinaarmula qaluiniirutivut asijjiqattarunnartutik suungagu nalautsaarneq isumaliurutiqarnerlu ullumiuyu tukusiumajattinni tamanna atuutiqangitiunnatsaaraaqangata taima narliiraarsimavugu taima suqqaqattarunnarluni asijjiqtauqattarunnarluni ammalu ujjirsutsiaarluta sangu ila asijjiqtauqattarunnarlunilu tamanna saqqipalliayun malittugin uqakkan ila quyannami kannerumajakka Nunavummiulimaat utaqqigunnatsaarsimammata tukisiumatsaangatalu kikkulimaatsia tamatumunga attortausimammata siarmaqpalliaassimanaqmun kisiani iluunnata katilluta saatassaunivut daalatsiarsimalivullu Nunavummi uluqianartumi tailimat gutausimamman saatatsaunivullu piliriaqatsianivullu suli kañussigialik tamakkua qasuyauvalliagaluartillugi maliktaugiaqarsimayut ammalu atuutiqainnarluta inuuqatigit qanigiiluattaileqattarlutik ammalu qanigiiqaluattaileqattarlutik qanimaguvit aggatillu waasainaqattarlugin quyannami.
Hi, I'm seeing a lot of comments on social media. There are some real issues with the streaming on CBC, on Premier's Facebook, and on the Government of Nunavut Facebook pages. We are very sorry about that. It is an internet issue. Things are really spotty right now. This is being recorded and it will be played on CBC radio, I believe, at noon. I will double check and get back to you before the end of this. We are sorry. It isn't under our control, but we do want to let you know that it will be on radio soon as well, if you want to check in then. Thanks.
Amisag go hakisayak ko kakatang atak tamak ko CBC ko sakya titaw ni nga kalaw ngiliw ko tiyak nga kaya kibipidyo tigil lugo. Kasi anita ko to saksaw kanila nga mayo CBC na alaw tikko hula ni walayo kaw yigya lang nga nga ila mamaya na galaw kasi ani tamak ko sakya kanila nga mayo.
Ken Driscoll, APTN National News. The medical travel patient who contracted COVID-19 while down south, I'm wondering if you could update their condition.
Ken Driscoll, APTN, komunitay na nabilang sa mayo na wadyo naktak tuminitay na kanoy lang mga kausakikon nakyo.
The individual remains in hospital and is stable. COVID-19, although the individual remains on a COVID ward, it's not the COVID itself that's keeping the individual in hospital at this point.
Tana sulian na belo meunit si mayok kanoy nga sukapalias mangito kanoy ngit siya tu galo sulitana no gadyo anak 19 linno aner bimela avitos ila tay kani khataw yo kanoy kalwak tilu.
Taking a look at the list of things that are going to be opening under low risk, daycares are included there. I'm wondering, how are the daycares going to look different? When you look at some of the Southern examples, you see playgrounds with circles drawn that children aren't allowed to leave. I wonder how that's going to work in Nunavut. Could you explain that to us?
Tako titiras mayo na le mate palle na mga tawlo anak tumingin naksaw na tati sa ulun pa revi hanok lita magwaping nga katigi katalo ti katingalo ti taman na ulo anak ko taw dangin man.
We're going to be meeting with the daycares to discuss and review guidelines and recommendations on enhanced hygiene, and they may have to have reduced hours so that they can maintain, so that staff will have time to do cleaning at the end of the day. But children, it's very difficult to get them to respect some of these boundaries and social distancing, so we'll find alternative ways to minimize the risk to them.
Tako kati makataw katang na tu pa revin nalo na yak viulutik maliktaw galing ni kamalo atuli ko yaw sa mayunik ang maloy kakangi nakataw sa makatang na tu sa butamak ko kanayak ti salo maksay hatakon na kudlugi matunya ila matulawin ningin tako aluso ko si ayong naktu galo tay mamalit siya taw gaso ningino katigini kanilo at tay lahat na mo kasi na asting itigo taman na gaso hatang na tabo.
And I'm wondering about schools. You have schools listed on the document under medium risk. I'm wondering that schools, especially Nunavut schools, are quite crowded, and as you mentioned, children aren't always the best at respecting social distancing. Why are schools listed as medium? Can you explain what went into that decision?
Takwalike ilin na bit solo khitiago tumiulo ga nak tumi nirakabigi tamani Nunavut mihawi magata ilin na bit amiso kaya alam nilid na takasungum mata ang malutak nalat siya gunito na haksati sa kusyo mo tano ka usay gun nakyo taman na ulo kaya naktumin nga kano kitiani nakakamangapyo.
The best of our understanding right now is that the older you get, the more likely you are to catch and transmit COVID-19, and the more likely you are to have more serious consequences from it. It's still relatively low risk in the teenage years, but it's certainly more risk than the age that children would be in daycares.
Ulo mi mo hawi si mayat tin nita makwa so si pawaya ko pala alak tilugi ulo kaya nak tumin naksagun na nga tano kadjam nak 19 takam na nangmut ang malo kanin malaki gundam naksaw gundam nakataw matatamak ko wikay matkutuilo tamatumong ano kadjam nak 19.
Rajni Sharma, Nunavut News. Dr. Patterson, you mentioned 25 people can gather together outside. Does that mean people from different households, or is there a limit as to how many people from different households can get together?
Rajni Sharma, Nunavut News, Connecta ko Dr. Patterson uhakaw gawin sila may katikunak sinakasugit 25 ngulutik solo ilumyo katigi balo kanutigi ilumyo katigi ngito tayo mat katikataon na lang ang mata 25 ngulutik.
It's 25 people. It could be any up to, I guess, 25 households. There would still be a strong recommendation about maintaining distancing and that sort of those other measures, but this allows people the flexibility to have a bit more social life.
25 magun lugit so lo takwa 25 in lumi hatiging itu katigun naktut taima kisane ino hatigi khanigi lo tele to akata taima tana se jasma ya butaima ino hatigi katit sa hatta kun naks khullugi khubya so hatigi luti.
It says here that travel restrictions are going to be in place until there is an effective therapy or a vaccination for COVID-19. Now, is this in addition to the 3 conditions you mentioned that have to be met?
Takwa tikigun nakto sulit tabe hati tau lang mata tikit tele hatta tau lutik takwa sulo kapo tita khalik khatamatu mga khaniman nan ila Nunavut nak 19 mut ilagi jaw lunitan na pingasunu nalunay hatta lok tanutan na ilagi ilaliw ti jaw ba.
It's referring to the border measures, and there's a few possible scenarios at which we could see those lifted, but the bottom line is we should expect that they'll be in place in some fashion for quite some time, months.
Takwa Nunavut kilingan ni matu simani suli matu yaw simalang mat adjiging itu ni naluna yak tau nak tu galo akisa ni takwa suli takka sang ni naluna ngitu taman na Nunavut tikit tay review ni nga suli tay maakit tau simalang ayo.
I'm a transfer Nunavut News. You have household visitors considered as a high-risk category, and opening workplaces in the low risk. I'm wondering, technically, I guess both are people gathered together indoors. What's the difference between a workplace versus a household?
I'm a transfer na siya connect ako luwa nak tumin nakakabigi pula ka katigi kung namningit sulilis isulit tabi kapti tao lang amat atako alo matuyak tao talikalo ay kanayak bi kano tako at sigingin nakangatik kanititayli unanang.
The nature and the duration of the contact at home that we have with the people we live with is very different than the nature and duration of the contact we have with the people we work with. And so with most, if not all, communicable diseases, there's much more transmission that occurs at home or at parties and visiting together than occurs in the workplace.
Taman na nalo na tao si mamad ambalo kano tigi kating nga katang ningi solo pula katigi ako ni pula katigi gunang ngata ambalo kanigi naksaw gayo gayak to take isa ni tako kanayak bin ni katingi naksaw katang ngata tunga sige gaswa gunak to tillo tabak ko siyamak gunam ningi angik kani siyamak naksaw gayo sungum mata ambalo kating nga katigi ni siyamak sakay naksaw sungum mata angik kani.
So will indoor gatherings stay at the 5-person limit until we reach, until we can lift those high-risk measures?
Yeah, that's the current plan. As evidence evolves, we may adjust all of these ratings of low, medium, or high risk. But for right now, yes, those would be one of the later ones to be altered.
Mana yuday mapang nasimayogo kisa hitamakwa sejak pala hatam ningin khawi sa palangin na hatalang agatigo sulo at sinnak pa kitiagot amalo at hubasin nak pa ulo ka naktumin ningi khawi sa palangin na hatalang ayago.
And would travel restrictions mean the final thing to be lifted? And no, obviously, timeline for that right now. Does that include the isolation hotels? That wouldn't be lifted until there's some sort of vaccination.
Takwa tao suli tikigum nakte suli tabahak niyam nakakataka bigi takwa lekya to yung mivimito halo nani suli taman nakaputa kalawin nga ni novadyoam nak mga yumi suli to yung mivimni katagakang nakan.
Yeah, the border restrictions, the isolation hubs will be one of the last, if not the last restriction to go. And the threshold, the easiest threshold for that is reliable treatment or vaccination. We'll continue to monitor the evidence and look at other measures that might reduce the impact of, or other methods of reducing the impact of closing those hubs.
Impact of what?
The impact it would have if we closed the hubs.
Tan natili yaw si magutiyo yok tan kingulek pango gayak tu tako akalo na ni to yung mevime no tu titaw kay nakatak tu tan na kingulek pango lo ni pik taw gayak tu tako alo solo inuli saw titahat sa lekhat isa magikayakan na gayak taw ubalo at tu ni halo adyang ipa tako matujaw gayak nakata tu yung mevime titaw hatak ning ulo kaya naktumigun nek so kay gutigo tay magigatu nilak tu
Jackie McKay, CBC News. So this plan seems to be rolling out, starting with low-risk measures on June 1st. I'm interested in knowing more about how this is rolling out. So on June 1st, will all the examples of these low-risk measures be available?
Jackie McKay, CBC Kunita ko parnaw TV video tigil logo kano atulog titaw balle na mga tasulo ulo ka nang ituminak pango na tati June 1 may matiyak pala lang lutik kano ta ko sak ila tay ilo nati matiyak pala lang to June 1 may balo kano.
No, we'll start with just the ones that we mentioned next Monday and then work out from there.
Gatay ko to how sa kaya bu matiyak kayak to naggadyaw may pigyang lo.
Right, so the starting with parks and daycares and bigger outdoor gatherings, but things that are also included on this list like opening gyms, outdoor day camps, travel between communities, are you just going to let us know when those become available via these press conferences every few days, or is it going to be a new set every 2 weeks?
Tako matiyak pala na nakakabigay ulo ka naktumingin nakaksati so lumang ngay serbit Pairivit, ang malukati kataron na luti sila may amisunak site, tamakkwalo ay kaili sabit, ang malo surusur na tako, yakko, pairivit sila may tako, makko pinasako sinagay, patamatir taw valyak talang ayo ubalo, lutaman, alo na sa valyak talang abisi.
We'll be announcing periodically every 2 weeks or so most of these changes, and I apologize to everybody for the confusion that may cause. The concern we had is if we set out a timeline with dates, June 1st this, June 15th that, and so on, it may be worse if we either evidence changed or the situation changed and we had to alter the schedule. So we'll try to give people as much notice as we can, but this gives us the flexibility to respond as things change.
Makto pinasako si nagay patik na manalo nang sa balaya talang ayugo asid sak palaya niyo unique mamaya kalawak to ngataman na naluliro daw tuwin na kaya hanga solo June 1 may matur na nakakaya vutan na kinuniago ulunik solo June 15 minalo na sigut na tamako asid sak talang aningin note sakit to hakay patay maulunik hanga lang ningin ninalo na sisimagumangin nama tako asid sak talang ang matakangakut matur na ningit Ambalo sibong agu kaya kasi magasawa katalang agalo waktu go ambalo tamakko asid jakta katakon na ningi nat kaya matsa katang na kaso.
To avoid confusion for people, how should they know what they should be doing? Will this package we have be available to the public, or will you post it on the website?
Tako nalo na katang na ngin mata inui tamakko matiyak pala ng ipidyo tigil lugita ko alo parnaw ti nalo taksakik ko yati ato inaw lang abado balo kakisaw yak ko ikiakidig ko tukisigabi ko pitakaka.
Yeah, that document will be available on the website or may already be up on the website, and we will be, because most of these are done under public health orders, we will have to be rewriting the orders and putting out new orders periodically to allow these things to happen.
Tako titirak sumayo kakisaw yak ko tukisigabi may sakyo malik pala yung alaman at saw tigi tako ilo na tigalay anahan nang itulirin ang mutilisid yung tigi simayak ka asid sak tao katang na nga ta sakik tao kakay panutanik tusaktit sa katalang ang miyugo.
Other provinces such as Ontario have started opening up and have seen spikes and increases in COVID cases. Those increases in transmission, does that impact how we roll out this plan?
Tako Ontario may matuyak palya ning ino pidyo tigillugi tako siyang mapalya ning amisong mapalya si mamata Nunvaut anak 19 taon na ni taman na atoy nakalangaba tako atulak tita palya tilugi matuyak palya ng mapangnaw titi.
We're monitoring the situation in Ontario and Quebec and other jurisdictions where Nunavut often travel to and from, but with our current border restrictions in place, we don't think it's going to impact what we do over the next few weeks, but we'll see how it goes.
Taman na kawisak palangin naktabot kanuilong mga tay lahat sa palang mga ta Ontario may Quebec milo asingin nilo nun awitok si mavio yun nun avumiyot upagayot tangin ni takwa akit si matilugi tikit tayo litit sinang mo ta ato takat sa naksuriya bo taman na tikit tayo lititaw ninganik suliw.
Does Nunavut currently have enough epidemiologists to conduct contact tracing if we needed it within the territory?
Tamani no na bumita magkosa mapalya yuliginik kawi mayitamnik na mapat kiku katisin ng mga tanalo na yak si palya gayak to ni.
We have enough to maintain contact tracing for at least a couple of communities, and beyond that we have mutual aid request options with the federal government and other jurisdictions where we could get support if things got, our current staff were, if it got beyond their capacity. Sorry.
In man na namatut solo kikuni katisiyo ham ng mga Nunvaut anak ta sa mayo ni makuni no nalin ni tayo mapilarigon nat sa aktuman na kakanoy gayang ito kasi ani ang ikatigi guti ka sa mayo ko matok kuno singin nilo abitok sa mavio unit amako ikayo kun naksigayak tut ikayo ka gaya hasin ni ruta taman na sa mapalenakan.
Kent Driscoll, APTN National News. I know you mentioned it at the beginning, Dr. Patterson, but if you could outline for us in plain language exactly what Nunavut will be allowed to do on June 1st that they're not allowed to do in May. What exactly?
Kent Driscoll, APTN connect to kisnat siya to kunalo na sigum na kino na vuminut June 1 May kanuiliyon na sila kamana yu kanuiliyon nang itangin ni.
Thanks. One thing is all of these are, we're lifting the public health restrictions, but local hamlets may choose or may not be ready to open their parks or playgrounds, and individual daycares may not have staff back, but they're allowed to open if available. So daycares are allowed to open. Parks will be allowed to open to Nunavut, except the public buildings where people may gather indoors will be closed for now, and municipalities will be allowed to open their playgrounds. Outdoor playgrounds, sorry, Uli.
Ako ilo natikan na mangituloy ng mo sulit tabiw titaw si mayo nunalin ni sulu atoy na kaya kangim bata matuyak sigo mangikutit nang isak bingin ni balon ni suko sila na pingwapin ni pairibin nilo ni atoy na ipata matuyak sa tiging ito na reali kasi anita magka matuyak naksin to June 1 May pairibit nang isak bit malo kasi anita magka ilo ni katigya kang ito nang isak bit ilo kutingin ni tagatakwa lalo na yak si maya matiron na lang ni.
So when these things start to open daycares on Monday, people gathering in groups of 25 outside, what kinds of things do you recommend they do? Should they be still social distancing? Should they be wearing face masks? Like, I think some people will be nervous to maybe be in a gathering of 25 people.
Matranto no nat sa connect tamakwa revi nagadjami matiron nalalak tilugi tambalo 25 ngulutik sila may katigum nalalak tilugi kanu atuloy yakit sulino katigi kanigilo at telugi kakat baloki nang migo matuak si magyakak nalo nang ito kapya sugalahat talang ang matapilo ak tumi 25 makai katigum naksinakak titaw tilugi.
For those people who are nervous or have concerns or think that they're at greater risk, none of this gets rid of that ability and need for each of us to do our own individual risk assessment. And there will be people who will say, I'm at higher risk of complications from COVID or any other viral infection, so I'm still going to stay away from groups. We would still recommend, as much as possible, people maintain the physical distancing 6 feet or more. If people are concerned, then masks are an option when physical distancing can't be maintained. And we would, certainly support that if people are more comfortable when they can't maintain it. Wouldn't put out a strong recommendation until things like what happened in Pond Inlet when we thought there was COVID-19 in the community. And there will be individuals parents who feel that it's not appropriate to send their children back to daycare right now, and that's okay. We have to all make our own individual risk assessments in addition to these public health measures.
Takwa kikutuin ni kapya sunek tut ismalu ti haklotik kisani tayo ismalu ni rutik tayo naminik uluran ak tumin naminik hawisat siya katakayali ilang ilo tayo kanim masakay naksausu nuwadyo anak tasakay naksaugun nakto asingin nilunit tamakwa solo katigi kanigi luwatay katakaya hamnak to suli 6 feet ungatano lunit kina mego matuak sumagumaguti tayo matuak sumatsakun nakto tayo kakayam na sauso kigutik kisani katigi kanigi luwatay ligum nangit patatay matuak sumakoya katakayak to nga kisani atuli ko luwa kayang itakatay amisuluak to ni kanigi to ni tayo mitsi matalim may nuwadyo anak to haksukit sitilo tayo sumalo ti halikay na yugat at matuminga matuak sumakatakayak ng milo atuli ko yitsuta kisani ang iyok kakayaw yun kaya kiwi mo tit sigumangit ko tikitok nga minit kano yung itsak miyo tayo mineulo ka anak to may suri ko ti sumaliw ko ti katsakang na miyo.
Jackie McKay, CBC News. I'm curious about something you just said in Kent's question about the roles of municipalities on these opening up measures. Ultimately, is it going to be up to municipalities to decide how much they want to open up as you allow it through these measures?
Jackie McKay, CBC Kumnita ko ano nalinig ka mao yung sumaliw ng nakakaw gabigi hangak ko matuyak sigun ng mga tayo iminis sumaliw ng nalalakay pe atula ko yismayangin eh.
Yeah, it's both of us. There's public health measures that say we don't want these larger group activities to be happening at all. And then the municipalities, each municipality or each owner of an outdoor playground has the responsibility and the liability to ensure that it's safe, not just that it's clean, but that the other measures, maintenance measures that may have lapsed, those need to take place. So people should check with their local circumstances, and I can't make those decisions.
Tamakking luta tamakwa na ham nang itularan ng malitaw ko yung simayo nalo nang ito suli malitaw na tutsulo no nalinay gava mao yung ham lakulunit ismalo te hakata ko yung ilo ti tayo may ismalo ko ti kakunat sa mayo sulo ato ni sila may sa ko sila ano pa pingwa bi matuyik tayo hong ipagi nunalita matumingay ismalo ko sa kakunat sa mayo kisani pilirit siya luti kambalo sa atat sa guna kami kambalo salumatit sit siya katang luti malito ako ti tamak ko nga malito ko yaw si mayonik nunalin ni ato ni jigi katta jayot sa ngin makawigi katta ko na lang ayon nunamin ni.
This week, you will have to decide if to extend the public health emergency, as we've been doing every 2 weeks since about March. When do we get to a point where we stop extending the public health emergency, and what does that mean?
Kabani pinasa ko sa may sumaliw ko takahang nakabitaan na mabakayak tawag akang na mga naham nang itularin ang moto abon naktimil yuti kang nivot makuni pinasa ko si kanini sa March mini tayo may tayo katang kano ilalagay balay taman na.
Most of the orders that we have in place are under the umbrella of the public health emergency declaration, so we will have to, if we want to keep those orders in place, we have to keep extending the public health emergency declaration.
Ita ko ilo na tigala ana hamang itularin ng mo tuwang naktumigot ham ng mo dalo na ko taw si mayumi mata tan unga baka taw ga hakatak na to suli malit taw ga ile tatsu mailo ani mata tuwang naktularin ng mo dalo na taw si mayu ilo ani.
Thank you.
Rajni Sharma, Nunavut News. Dr. Patterson, under the example of medium risk measures, it says visits to long-term care facilities. I just want to clarify, or actually, can you clarify, does that mean like visiting elders?
Rajni Sharma, Nunavut News kun niluta Patterson. Tako kitia golo kaya naktumin na tayo matatitirak si mayo pula kaya tayo kun nang ningi innakubi ubalo pigatok kubin ang ikarayaw yun. So innam na pula kaya katakon na lasiban.
Yeah, the reason for putting it in there, it depends on the nature of the visit. One person, like a son or daughter going to visit their mother or father alone and respecting social distancing, is probably not very risky. A whole bunch of people getting together or unrestricted access in and out is higher risk. So it's got some gray area, but if we hold it to those limits and immediate family, there's ways to do it where the risk is still manageable. And that's what we'll be aiming at, because one of the consistent concerns is people being able to meet their parents and check on their own well-being.
Tana fidgeting at Anna Nalonata Hataw Simaniga Sulu, Atawsam Mupula Reacta Gunak Sehulu, Sulu, Emna Yakubalo Panigi Yao, Anana Minut, Atata Minuluni, Pulare Hatagunang, Ningitaman Nolora and Aloangimbat, Sulu, Amisulu, Arlo, the Atautsku, Hatangito, Hatataman Nolora, Nasoringinako, Tamana Nalonagalat to Galoakisani, Tamako, Ilan Lata, Rayao, Hitunga Rayao. Pula kaya katakon namin nga kaya kaya katalo tiang ayok kaya minuta man nakanit suringin ako.
Thank you.